Anxiety and PE. How mental control boosts lasting power. Begins with a truth many men are never told. The most powerful sexual organ in your body is not below your waist, it is between your ears. If you have ever felt your heart race, your breathing shorten, and your thoughts spiral during intimacy, you have already experienced how deeply the brain controls performance. Today, we're going to talk honestly, calmly, and scientifically about how anxiety influences premature ejaculation, and more importantly, how mental control can restore confidence, stamina, and lasting power. As men grow older, especially beyond 40 and 50, stress accumulates from work, family responsibilities, financial concerns, and health worries. That stress does not disappear when the bedroom door closes. It follows you, tightens your chest, and signals your nervous system to stay alert. When the brain senses pressure or fear of failure, it activates the sympathetic nervous system, often called the fight or flight response. Blood pressure rises, adrenaline increases, and muscles tense. While this response is helpful in emergencies, it works against you during intimacy, because ejaculation is strongly influenced by heightened arousal and nervous system overstimulation. Scientific research shows that the timing of ejaculation is closely regulated by neurotransmitters such as serotonin and dopamine within specific brain regions. When anxiety dominates, serotonin balance can shift, reducing the brain's ability to delay climax. In simple terms, the more anxious you feel, the less control your brain exercises over timing. This is not a personal weakness, and it is not a character flaw. It is biology responding to stress. Sexual health experts, including respected physicians like Dr. Mohit Khera, consistently emphasize that performance anxiety is one of the most common contributors to premature ejaculation. The mind becomes hyper-focused on outcomes instead of connection, creating a loop of anticipation and fear. That loop speeds everything up. The good news is that because the brain is involved, it can also be trained. Neuroplasticity, the brain's ability to adapt and rewire, means you are not stuck with current patterns. Simple breathing exercises can lower adrenaline within minutes. Slow diaphragmatic breathing activates the parasympathetic nervous system, the rest and relax system, which supports better control. Regular physical activity improves blood flow and enhances serotonin balance. Adequate sleep stabilizes mood-regulating hormones. Even mindfulness meditation has been shown in clinical studies to reduce anxiety levels and improve emotional regulation. As we move forward, remember this key principle. Lasting power begins with mental calm. The more you understand how your brain influences timing, the more empowered you become to take control. And what you are about to learn next may completely change how you view performance forever. As you begin to understand that anxiety is not your enemy, but a signal from your nervous system, something powerful starts to shift inside you. Yet here is where the deeper truth creates suspense. Most men who struggle with premature ejaculation are unknowingly training their brains to react faster every single time they worry about it. Each anxious experience reinforces a mental shortcut, a rapid pathway between fear and climax, and the brain, designed for efficiency, becomes very good at repeating what it practices most. This is why simply trying harder or distracting yourself rarely works for long. The brain interprets effort mixed with fear as urgency, and urgency accelerates the process. Sexual health specialists often explain that anticipation anxiety activates the amygdala, the brain's threat detection center, which then signals the body to prepare for action. Heart rate increases, pelvic floor muscles tighten, and breathing becomes shallow. Tight pelvic muscles combined with shallow breathing significantly reduce control over ejaculation timing. What many men do not realize is that control is not about suppressing sensation, but about regulating arousal in waves. Experts, including Dr. Mohit Khera, frequently highlight that awareness and pacing are far more effective than force. When you learn to monitor your arousal scale from 1 to 10 and stay below your point of no return, you interrupt the automatic stress loop. A practical method supported by behavioral therapy is the start-stop technique, which involves slowing stimulation when arousal rises too quickly, allowing the nervous system to settle before continuing. Over time, this retrains neural pathways and increases tolerance. Another science-backed strategy is progressive muscle relaxation, where you consciously tense and release muscle groups, teaching the body the difference between tension and calm. When practiced daily, this reduces baseline anxiety levels, making it easier to remain composed during intimacy. Nutrition also plays a quiet but important role. Diets rich in omega-3 fatty acids, leafy greens, lean proteins, and whole grains support stable blood sugar and neurotransmitter balance, which influence mood and impulse control. Excessive caffeine and alcohol, on the other hand, can heighten nervous system stimulation and worsen anxiety symptoms. Regular cardiovascular exercise improves endothelial function, enhancing blood flow and confidence while lowering stress hormones like cortisol. The most transformative change, however, often comes from reframing your mindset. Instead of viewing intimacy as a performance test, begin to see it as connection, presence, and shared experience. When the goal shifts from proving yourself to enjoying the moment, the nervous system relaxes naturally. This mental reframing takes practice, but it creates profound biological change. You are not broken, and you are not alone. What you are experiencing is a learned pattern that can be unlearned. And in the final step, you will discover how combining mental calm with consistent lifestyle habits builds lasting control that strengthens not just your performance, but your overall vitality and confidence. When you combine mental awareness with steady daily habits, something remarkable begins to happen, because the body follows the mind, and the mind responds to consistency. Lasting power is not created in a single night of determination. It is built quietly through repetition, calm breathing, stronger circulation, balanced hormones, and confident thinking. As men move into their 50s and 60s, many assume that declining control is simply part of aging. Yet scientific evidence shows that lifestyle choices influence sexual performance far more than age alone. Regular resistance training supports healthy testosterone levels, which play a role in libido, mood stability, and energy. Moderate sunlight exposure and sufficient vitamin D contribute to hormonal balance and immune health. Quality sleep, ideally 7 to 8 hours each night, regulates cortisol and improves serotonin activity, both essential for emotional control. When sleep is poor, anxiety rises, and with it, the risk of rapid climax increases. Hydration also matters more than most men realize, because adequate blood volume supports proper circulation and nerve sensitivity. Pelvic floor strengthening exercises, often called Kegels for men, enhance muscle coordination and provide greater control over ejaculation timing when practiced correctly and consistently. However, true mastery goes beyond muscles. It involves emotional resilience. Stress management techniques such as journaling, gratitude practice, and guided relaxation reduce chronic tension and help the brain remain steady under pressure. Over time, these habits reshape neural pathways, reinforcing patience instead of urgency. The philosophy often emphasized by experts like Dr. Mohit Khera reminds men that sexual health reflects overall health. When you care for your cardiovascular system, nourish your brain, manage stress, and maintain meaningful relationships, performance improves naturally as a byproduct of well-being. Confidence is not forced. It grows from preparation and self-respect. It is important to remember that setbacks may still occur, but they do not erase progress. Each calm response to a stressful moment teaches the brain a new pattern. Instead of fearing intimacy, you begin to approach it with steadiness. Instead of racing toward an outcome, you remain present in sensation and connection. This shift reduces performance anxiety immediately, because the mind no longer interprets intimacy as a threat. The transformation is subtle at first, then undeniable. Energy improves, sleep deepens, mood stabilizes, and relationships strengthen. What started as a concern about timing becomes a gateway to total wellness. You realize that control is not about suppression, but about harmony between body and brain. And that harmony is within your reach through informed choices and daily discipline. If you are benefiting from our topics, please subscribe, like, and turn on the bell notification so you can see our new videos early.